Have you ever met somebody and as you're talking to them, it comes out how old they are? And let's say they're 75 years old. And whenever they tell you that, you're shocked. You're thinking to yourself, man, I would never have guessed that they were 75 years old. They have energy, their posture is good, they're not taking medications, they're living their lives, they're doing the things that they need to do. They just seem like they're so much younger, like they seem like they're 60 years old, but here they're 75. But then have you ever noticed that there are some folks that is kind of the opposite? That you meet them and their posture is distorted, they're always talking about the pain they're in, their life revolves around their doctor's appointments, the medicines they're on. You know, they're really limited in the things they're able to do. Their family wants to go on vacation, but they have to stay behind. They just can't physically do it anymore. And you would think that they were an older person, 70, 80 years old, but then you find out they're only 60. And have you ever wondered, what's the difference? I mean, how come some people seem to do so well as they age, and yet other people's, they just seem to not do well at all, okay? Well, I'm Dr. Jeff Schels. I'm a chiropractor here at Advanced Chiropractic, and after having helped over 10,000 patients at our office over the last 20 years, I've noticed some patterns that I think are real telling when it comes to that phenomenon. So I just wanted to demonstrate that on this chart here, okay? So a lot of times what happens whenever a person is younger, let's say they're born and they're in their youth. You know, a lot of people have good health when they're younger. So they start, if this is health, they start up in this area here. And then what happens is over time, as people have different things happen to them, the normal stresses of everyday life, whether it's playing sports, whether it's high school football, they have car accidents, or let's say that they start work, their job is very physical, or they sit at a desk looking at a computer all day. What happens is people over time start to lose health, they start to lose functioning, and at a certain point, a lot of times it's whenever people get into their 30s or 40s, sometimes 50s, sometimes earlier than that, they will hit a point where they start to develop some type of symptom. You know, symptoms can be pain, like sharp pain, dull pain, back pain, headaches, neck pain. But symptoms also can be general health problems, like they're tired all the time, or they just simply don't have the energy to do the things that they would love to do. But it can be any type of a symptom. What happens is at that point, people have a decision to make. And the thing is, what most people do whenever they have a symptom is they look at the symptom as the problem. They look at their back pain as the back pain is the problem. And so what they do is they do what they know to do for that, and that is take medication. So let's say they take Advil or ibuprofen or something like that. And let's say the symptom went away. However, if the medication didn't fix the problem, what was actually causing the pain, then the health actually continues to get worse over time. And so what happens is now they go down this road, eventually the over-the-counter drugs don't work, so what do? They go to the doctor, they may get prescription drugs, a muscle relaxant, Flexeril, something like that, a more powerful pain medicine. But if the medication didn't correct the underlying problem, what happens? The problem just continues to get worse. So what happens with people over time is they end up losing health, losing functioning. So now as they approach old age and they get older, they're at this very low level of health and functioning. And what exactly does that look like? Prescription drugs, multiple prescription drugs. They're in pain all the time. They have a hard time getting up, getting going, doing things with their family, okay? Now, when we look at it, however, if you go back many years earlier in most people's cases, there will be a time whenever some very important decisions should be made, okay? What happens is whenever people start to develop these normal aches and pains and issues, if they were to invest some of their time, effort, and money into not into necessarily trying to cover it up, but into finding out exactly what is the cause of it, what is the cause of that problem. Now, if they were to correct that and fix it, now what happens? You know, what happens when you invest in your health, invest in your future, invest in yourself? Do you lose your health, or now you start to go the opposite way, right? Now you start to improve your health. So now this person who is taking the initiative to invest in themselves, down the road, over the years, they end up at this very high level of functioning and a very high level of health. So what exactly does that look like? Well, what that looks like is, now this is the person who is 75, 80 years old. Their life looks just like a person who is much younger. They get up, their life does not revolve around the doctor's appointments or the prescription drugs or their pain, and they're living their lives the way God intended them to live, okay? They're a blessing to their family. So down here, burden to the family, up here, blessing for the family, right? So the key point is this. When it comes to your health, people need to make their health a priority before it becomes an emergency. Okay? I'm Dr. Jeff Schels with Advanced Chiropractic. If you or someone you know is in this area and they're looking for the potential for a non-drug, non-surgical approach that could improve their health, then I would recommend they give us a call at 254-778-2225. Thanks, have a great day.